one of the common questions that patients have prior to our surgery is, does the surgeon do the surgery, or is it the robot that actually does the surgery? And this is a very common question that we have. And the best way to describe that to a patient is when we are doing the surgery, the robot is mimicking the movements that the surgeon is doing. So the robot has no platform except that we are using it as an instrument. So the robot does not do the surgery, the surgeon does the surgery. When we're using the robot allows us to get into more difficult places that our hands and instruments typically could not get into to be able to see in these areas. And the best way to describe that to somebody is if you look at the male pelvis, it almost looks like a football. So you're working, the prostate sits at the bottom of that pelvis. And in order to get your hands in there or instruments in there, you have a difficult time getting in there and being able to see everything. But with a robot, because the instruments are more microscopic and because the camera does not take up much space, you're able to utilize the robot in a much more efficient fashion and are able to get to the area of interest without much difficulty. Other things that patients are worried about postoperatively is how much pain they're going to have, and that is typically more of a gas problem because we do insufflate the abdomen with CO2 gas. And what happens is that allows us to kind of, as we describe it to patients, it's like filling a tent with air, which allows you to see inside the tent. So if the tent was deflated and there was nothing there, it would be difficult to kind of see what is inside that tent. So by inflating the abdomen with gas, you're able to get a better look around the abdomen. That gas we do remove. However, postoperatively, a lot of patients have typically a bloating feeling or some pain in their shoulders because the gas, as it dissipates, can cause these kinds of issues. Those are all self-limiting and usually disappear within 2 or 3 days.